moving towards a more sustainable pharmaceutical industry. The pharmaceutical industry impacts the environment negatively through polluting and energy-intensive manufacturing processes. As climate change alters environmental conditions, global patterns of disease will change, and the demand on the pharmaceutical industry will increase, which will ultimately impact public health. As this change occurs, it is important to increase the sustainability of the drug manufacturing and usage to stop this feedback loop. Green chemistry techniques aim to improve the sustainability of the drug development process. A key principle of green chemistry is the use of catalysts, which can increase the efficiency of chemical reactions and increase reaction output. An effective catalyst can reduce the need for environmentally toxic chemicals. It can also reduce the energy demand needed to maintain harsh reaction conditions. With increasing ability to identify and manipulate genetic material across all living organisms using biotechnology, biological enzymes can be isolated and harnessed in chemical reactions. The process of enzyme-catalyzed reactions has been successfully incorporated into the synthesis of large-selling statins. Whilst this required detailed knowledge of the chemical structure of intermediate compounds, as well as the function of biological enzymes in altering this chemical structure, it allowed a highly cost-effective and sustainable production of statins under milder reaction conditions, reducing the complexity of the reaction.
The global warming potential of commonly used anesthetic gases is thousands of times greater than carbon dioxide. In fact, an hour's use of desflurane produces the equivalent emissions of driving 200 to 400 kilometers in a car. Anesthetic inhalant sustainability is key to limiting the pharmaceutical industry's detrimental impacts on climate change. We recommend that the use of the most environmentally harmful inhalants is reduced and that improved management of inhalants is facilitated during clinical use. Interventions such as education on sustainable practices and the progressive removal of desflurane from hospitals has been shown to reduce the desflurane carbon dioxide equivalent and reduce wastage costs. Additionally, institutions should collaborate with pharmaceutical companies and manufacturers to develop solutions that can capture inhalants to prevent waste gas accumulation in the environment. A common problem internationally is the inappropriate use of medications and lack of patient adherence, which increases their presence in the environment and the supply chain carbon emissions. But we recommend an interdisciplinary medication review program to tackle this. This will help us look at which medications are overprescribed. For example, in elderly and chronically ill populations, a cascade of medications is prescribed to combat side effects, resulting in a cycle of increasing drug use and further side effects. It will also let us examine the reasons behind the lack of adherence to treatment plans. For example, a common unintentional barrier is forgetfulness, exacerbated by complicated medication regimens with too many drugs. Reviewing problems like these can allow clinicians to reduce the medications prescribed and make it easier for patients to use.
Clinical decision support systems are digital tools designed to provide interactive information that assist healthcare professionals. They can be incorporated into electronic healthcare records and identify opportunities to improve patient care and provide holistic clinical approach. We propose using clinical decision support systems to improve interprofessional collaboration, pharmacist involvement, adequate prescription and deprescription, and promote shared decision-making. These systems have been integrated to identify interactions and incorrect prescriptions, to guide drug tapers and antibiotic stewardship, and for evidence-based deprescription. Medication watch lists have been created to prevent polypharmacy, potential drug-to-drug interactions, and side effects. Other tools that can be readily incorporated are the WISE list that focuses on shared decision-making and includes eco-friendly considerations, and the NIOSH drugs list of hazardous medications and their environmental impact. Finally, when it comes to disposal of medications after their supply to patients, there have been reports of poor practice not only among health consumers, but health professionals as well. The consequences include the presence of active pharmaceutical ingredients in environments such as waterways, which affect local biota and community well-being. To mitigate this issue, we recommend the implementation of public campaigns to educate the average health consumer and encourage them to bring unused and expired medications back to pharmacies for disposal. The educational interventions can be extended to settings such as schools and pharmacies to raise awareness about the impacts of medicines on the environment and public health. Achieving this goal will require a multifaceted approach to solve problems along the stages of a drug's lifetime, including the manufacturing process, physician education, and adequate prescription, patient engagement, and medication disposal.